How to elicit the history and prepare before physical examination of the oral cavity and the larynx. First, it is important to establish rapport. Ask for the patient's name and chief complaint.
Good afternoon.
Good afternoon, Doc.
How can I help you today?
Doc, I think I have sore throat.
Proceed in eliciting for a thorough history of the patient's condition. Inquire for the patient's general history and ask for any presence of sore throat, hoarseness, pain, cough, ear infection, difficulty in eating, difficulty in swallowing, and difficulty of breathing. Ask for the alcohol and tobacco habits and also for the patient's general dental history. After eliciting the history and explaining the procedure to be done, proceed with the physical examination. Now, prepare the materials. For the examination of the oral cavity and the larynx, we will need a tongue depressor, headlight, laryngeal mirror, sterile gloves, and gauze. It is important to preheat the laryngeal mirror first and test if the temperature is warm enough for examination. After preparing the materials, put on sterile gloves.
Examination of the oral cavity. Let the patient sit upright. Make sure you have a good light source. Using the tongue depressor, visualize and examine the oral cavity. First, look for the boundaries of the mouth. The lips and the teeth are positioned anteriorly, the anterior tonsillar pillars posteriorly, the hard and the soft palates on the roof of the mouth, and the mucosa underlying the sublingual and submandibular glands on the floor, and the buccal mucosa laterally. Next, inspect the cheeks, gums, gingiva, vestibule, the teeth, lingual and labial frenulums, the margins and the sides of the tongue, the pharynx, the uvula, the hard and the soft palates, posterior pharyngeal wall. We let the patient say "ah" to check the movement of the soft palate and the gag reflex. Note for any lumps, ulcerations, nodules, redness, pain, swelling, dental caries, missing tooth, mass, asymmetry, exudates, or tonsillar enlargement. Palpate for any suspicious lesions and masses and determine their characteristics. Indirect laryngoscopy. To visualize and examine the larynx, a laryngeal mirror is needed. Position the patient seated upright and leaning slightly forward with the neck slightly flexed on the chest. Let the patient open his mouth and with his tongue stuck out. The examiner grasps the tongue with his non-dominant hand with the gauze and the laryngeal mirror held by the dominant hand. The light from the head mirror is then directed toward the uvula. The uvula is lifted on the back surface of the mirror, angled at 45 degrees, and is pushed backward and upward to visualize the larynx. It is important to examine the larynx in respiratory and phonatory position by asking the patient to take a deep breath and saying a high-pitched E, respectively. The base of the tongue, oropharynx, and hypopharynx should also be examined.